كل عام وأنتم بخير. أول محاضرة إن شاء الله في رمضان. And the title of our lecture today is Somatic Sensation. We would like first to define what is the meaning of sensation. Sensation is considered as the perception of a particular feeling initiated by stimulation of certain type of receptor by their adequate stimulus or by its adequate stimulus. So, for example, the sensation of forms or the sensation of touch or vibration are initiated by a stimulus, and this stimulus produced what? Produce stimulation of its specific receptor, and this gives you the sensation. Somatic sensation. Somatic sensation are defined as the sensation that's arising from the somatic structures. Sensation arising from the somatic structure due to stimulation of the somatic receptors in skin, muscles, periosteum of bone, especially periosteum of bone, tendons, joints. These structures are known as the somatic structure, and the receptors located in them are known as the somatic receptor that gives the somatic sensation. Somatic sensation includes, or the somatic receptors will give the following types of somatic sensation: touch and pressure, sense of posture and movement, we name it as proprioceptive sensation, temperature, pain, temperature and pain. Sensory modalities. What is the meaning of a sensory modality? Each unique type of sensation like pain, touch, vision, sound is called a sensory modality. It's called what? A sensory modality. What is the meaning of a sensory modality? We have a specific type of receptors for pain. We have specific types for touch, receptors for touch. We have photoreceptor specific for perception of what? Perception of light. We have auditory receptors specific for detection of sound. So we have something which is called the sensory modality. Sensory modality. What's the meaning of a sensory modality? We have something which is called specificity. We have something which is called what? Specificity. What's the meaning of specificity? Each type of receptor is specific for detection of only one type of stimuli. Each type of receptor is specific to detect only one type of stimuli. And when they are stimulated, they are going to send the information through sensory neuron or afferent neuron. And each sensory neuron carries information for only one modality. We have something which is called labeled line principle for the sensory modality. What's the meaning of the labeled line principle of the sensory modality? Each sensory neuron carries specific impulses or carry a specific sensory modality. For example, optic nerve coming from the eye is specific for carrying what? The visual information. The auditory nerve is specific for carrying what? For carrying the hearing information. We have the olfactory nerve specific for what? Carrying of the olfactory impulses. The same in your skin. You have something which is called a specific pathways for pain, which is different from thermal sensation, which is different from the proprioceptive sensation, which is different from the vibration sense. This means that each type of a sensation has its specific pathway to reach to the cerebral cortex, and this means the labeled line principle. Sensory modalities are either general sensation or special sensation. Modalities are either general sensation or special sensation. As we classify sensation from the start, classified into general and special. General include visceral, somatic, visceral, and organic, and special sensation include vision, hearing, smell, taste, and we have sense of equilibrium. Somatic sensation include tactile sensation, that means the sensation that depends on touch. The sensation that depends on touch. For example, touch, pressure, vibration, itch, and tickling. Thermal sensation, which is a sensation that detects the changes in temperature. Sensation that detects changes in the temperature. Pain sensation that detects tissue damage. Proprioceptive sensation or proprioception, awareness of the limb and the joint position in space. And we can add tactile to proprioception to be what? To be mechanoceptive sensation. To be mechanoceptive sensation. Visceral sensation are the sensation coming from the viscera. Visceral sensation are the sensation coming from viscera, like what? Like pain, renal colic, intestinal colic, biliary colic. This is a colic coming from what? Coming from the viscera. This is what that is considered as a visceral sense. Sense of fullness of the stomach, sense of fullness coming from the bladder. That is what? That's a visceral sense. So we have a visceral sensation. And we have another category of sensation which is named as organic sensation. Organic sensation. So again, sensory modality. Each unique type of sensation is called a sensory modality. Each sensory neuron carries information for only one sensory modality. Sensory modalities are either general and special. We classify the general into somatic, visceral, and organic. Somatic include mechanoceptive sensations that include tactile and proprioceptive, thermoceptive sensations that detect changes in the temperature, and pain sensation. What's happening to produce sensation? The process of sensation depends on the following four steps or the following four events. Number one, the stimulation of the sensory receptor. The stimulation of the sensory receptor. We have here stimulus energy. Stimulus energy. This energy may be what? Maybe light for the photoreceptors, maybe touch for the touch receptors in your skin, maybe what? Maybe temperature changes. For example, the sensation of warmth or coldness. This is going as a form of energy, and this form of energy is going to produce what? Stimulation of the receptor. And as we mentioned before, each type of receptor has its specific stimulus. The photoreceptors are stimulated by light. The olfactory receptors are stimulated by the chemical substance known as odor. The taste receptors are stimulated by the chemical substance that's called tastent substance, or the taste substance that produce stimulation of the taste receptors that include sweety or sugary, or for example, if you have something soury, stimulating the taste receptors specific for it. So according to the stimulus, we have energy. We have energy. This energy is going to produce what? A stimulation of the receptor. And in this condition, the receptor is going to act as a detector, to detect this energy, and also it's going to act as a transducer. It's going to act as a transducer. What is the meaning of the transducer? They are going to transform the stimulus energy into receptor potential. What's going? We have a change in the membrane potential of the receptor. We have a change in the membrane potential of the receptor. The receptor membrane potential is changed. The state of polarity present in the receptor is going to be changed. And what is the change? Is usually depolarization. Is usually what? Depolarization. Most of the receptors are stimulated by depolarization, except photoreceptors are stimulated by hyperpolarization. What is the meaning of that? When the energy of the stimulus comes, it's going to change the membrane potential of the receptor and produce a state of partial depolarization, in most of the body receptors, except the photoreceptor that are stimulated by hyperpolarization. For example, the touch receptors. When we have an object with light mechanical object touches your skin, it produces deformity in the shape of the receptor. This deformity in the receptor allows sodium influx inside, and this sodium influx is going to produce depolarization. It's going to produce what? Depolarization. So the second event is the generation of the receptor potential, or the transduction of the stimulus into electrical event, and this electrical event is the receptor potential. So the first is the perception, the detection of the change, then the transduction of the stimulus into a receptor potential, and in this condition, the receptor potential is a change in the membrane potential of the receptor. It is mostly depolarization, except the photoreceptor, which respond by producing hyperpolarization. By producing what? Hyperpolarization. Then, what's going? The receptor potential is going to spread along the sensory neuron until it reaches to the first node from there. Once it reaches to the first node from there, the receptor potential is going to generate action potential when it is strong enough to reach to the firing level and open the voltage gated sodium channels, it's going to produce generation of action potential or generation of nerve impulse. So again, energy of the stimulus, receptor potential, travels until reach to the first node from there, generates action potential or nerve impulse. Generates action potential or nerve impulse. This means that the energy of the stimulus is transformed by the receptor into a receptor potential, and in the first node from there is going to be transformed into what? Into action potential. Going to be transformed into action potential. So when the sum of the graded potential reach the threshold in the first node from there, the first neuron in the specific tract, in this case from the peripheral nervous system into the central nervous system. We are now carrying the nerve impulse from the peripheral nervous system to the central nervous system by what? By the first order neuron or by this sensory neuron. This impulse is going to travel along the sensory pathway until reach to the center in the cerebral cortex, until it reach its center. And when it reaches to its center, we have something which is called integration of the sensory input. This occurs when a particular region of the central nervous system integrates a number of a sensory nerve impulse and result in a conscious sensation or the perception. You are now feeling the sensation at the level of the cerebral cortex. The cerebral cortex has a specific area called the primary somatic sensory area. This primary somatic sensory area identifies the meaning of this touch sensation, understand the meaning of this, perceive this type of touch sensation, and also it's going to proceed this information more to the association areas in order to understand the meaning of this sensation. So the process of sensation include number one, stimulation of the sensory receptor, and in this condition, the sensory receptor is going to detect the change. Number two, transduction of the stimulus, the transformation of the stimulus energy into receptor potential. Number three, generation of action potential, when there is a summation of the receptor potential occurring in the first node from there, or the receptor potential from the start is strong enough to generate action potential in the first node from there, the nerve impulse will be generated and the nerve impulse will be conducted through the sensory neuron until reaching to the central nervous system. And in the central nervous system we have a center that produces perception and understanding of the meaning of the sensation. Sensory receptors. What is the definition of sensory receptors? We define the sensory receptor are microscopic specialized structures located at the peripheral termination of sensory neuron. Again, microscopic specialized structures located at the peripheral termination of the sensory neurons or the afferent neurons. So we have receptors, and we have a plenty and millions of types of receptors inside our body. We have different types of receptors that can be classified according to their microscopic structure, their shape, or their location, or we have the type of the stimulus or the mode of activation. We have microscopic structures. According to their shape, we have something called free nerve endings, and we have another type which is called encapsulated receptors, or we have another type which is ciliated receptors. Location of the receptor. Location of the receptors. We have exterior receptors and interior receptors. Receptors that's produced or stimulated by external source of energy or external change in the environment. We have interior receptors that's stimulated by internal form of energy or by change in the internal environment according to the location of the receptors. We have classification according to the type of the stimulus. We have thermoreceptors stimulated by thermal form of energy. We have chemoreceptor stimulated by chemical form of energy. We have baroreceptors, the mechanoreceptor stimulated by the changes in the blood pressure. We have stretch receptor stimulated by stretch as a mechanoreceptors. We have mode of activation, another way to classify the receptors according to the mode of activation. The mechanoreceptors are usually stimulated by what? By a deformity appearing in the receptors. The chemoreceptors are stimulated by changes in the chemistry, changes in the blood gases, it changes in the ions concentration, it changes in the sodium concentration, it changes in the hydrogen ion concentration regarding to the mode of activation. Sensory receptors based on microscopic structure. Here we have classification of the receptors according to their microscopic structure. For example, we have here free nerve endings, and these free nerve endings are simple receptors specific for what? Specific for pain sensation. Specific for pain sensation. And we have here Pacinian corpuscles, and these Pacinian corpuscles are free nerve endings, and this free nerve ending is surrounded by several layers of elastic and connective tissue, and in between we have something which is called viscous fluid, and these receptors are specific for what? Are specific for detection of vibration, We have here ciliated receptors. The cell is provided with cilia, and we have here the receptor is synapsing with the sensory neuron, and the change in the orientation of the cilia, change of the shape of the cilia, the deflection in the cilia is going to affect the neurotransmitter release from the receptor, is going to affect the rate of the release of the neurotransmitter, and this neurotransmitter is going to stimulate the sensory neuron, So we have here different types of receptors according to their microscopic structure, In this slide, we are going to look how can the sensory receptor transform an external signal into a membrane potential, into a nerve impulse. How can the sensory receptor transform an external signal to a membrane potential? Each type of receptor here has its specific or adequate stimulus, and they are going to generate the receptor potential and then the receptor potential here, when it travels to the first node from there and conducted along the axon here in the free nerve ending and in the encapsulated nerve ending, they are going to transform the receptor potential or the generator potential into action potential. Into what? Into action potential. On the other hand, we have here the gustatory receptors, the gustatory or the taste receptor. When they perceive the sugar molecule, they change the rate of release of the neurotransmitter, or they modify the rate of release of the neurotransmitter, and this neurotransmitter is going to affect the sensory neuron or the afferent neuron, and they produce the action potential. So we have here in this slide how can the sensory receptor produce transduction. What's the meaning of transduction? Transduction means the transformation of the receptor potential into action potential. Here, the transformation occurs in the first node from here. Here it occurs at the site of the synapse between what? Between the sensory receptor and the sensory neuron. The amount of the neurotransmitter released from the receptor is sufficient to generate action potential in the sensory neuron, and this will produce what? Produce the action potential in the sensory nerve. Classification of the sensory receptors according to their location. We classify the receptor according to their location into exteroceptors, interoceptors, proprioceptors. Exteroceptors located at or near the external surface of the body, and they respond to changes in the external environment. Interoceptors located in the viscera respond to changes occurring in the internal environment, like the chemoreceptor you studied in respiration, like the baroreceptors you studied in the cardiovascular, and we have receptors even present inside the kidney. We have the baroreceptors located in the juxtaglomerular granular cells that stimulate the release of renin. We have receptors located in the kidney for the oxygen level that stimulates the release of erythropoietin. So this is considered as interoceptors. Then we have proprioceptors that is detect the changes in the body position and movement, that detect the body position and movements. Classification of the receptors according to the type of stimulus. According to the type of stimulus, we have mechanical receptors that respond to mechanical form of energy. Thermal receptors respond to changes in the temperature. Chemical receptors stimulated by chemical energy or chemical form of stimuli. Electromagnetic, that usually they are stimulated by light, electricity, or magnetism. So we have another classification of the receptor according to the type of stimulus. According to the type of stimulus. Another classification based on the mode of activation. According to the mode of activation. Mechanoreceptors are sensitive to deformity. Deformity, touch or pressure or vibration are going to produce what? Change in the shape of the receptor, and this is considered as a deformity. And this deformity is usually produce opening of channels or opening of sodium channels, allowing the sodium influx inside the receptor, and this produce the depolarization of the receptors. Thermoreceptor detect changes in the temperature. The mechanism here of stimulation is that the change in the temperature is going to affect the rate of metabolism inside the receptor, and when the rate of metabolism is changed, there is accumulation of metabolites that may change the permeability of the membrane to ions. Nociceptors, they are stimulated by painful stimuli, and these painful stimuli usually are chemical substance, and this chemical substance produce stimulation of the receptor, and this chemical stimuli appear when there is tissue damage. So there is painful stimulus, which may be mechanical, may be chemical, may be thermal. They are going to produce release of pain producing substance, and this pain producing substance are stimulating the pain receptors. Photoreceptors are stimulated by photons of light. When the light strikes the photoreceptors in the retina, it is going to produce chemical changes in the photoreceptors. And we will discuss it in detail in the vision lecture. Chemoreceptors, which are detect chemicals in the mouth, like taste. We have receptors for sour, we have receptors for salty, we have receptors for bitter, we have receptors for the sugary substances, for the umami. We have changes. These receptors are stimulated by change in the chemical concentration of certain types of chemicals, and also the same for smell. Osmoreceptors, which detect the osmotic pressure of the body fluids. So we have here classification of the receptor according to the mode of activation. The osmoreceptors are detected or stimulated by what? By change of the osmolarity. When the osmolarity of the plasma increase, there is shift of water from inside the cell to outside, so there is a shrinkage of the cell. When these osmoreceptors or the cell show shrinkage, they are stimulated. Why? The water gets out from the cell. So we have classification of the receptor according to the mode of activation. We will start with the somatic sensation. Can you define for me what is the meaning of somatic sensation? It is a sensation coming from the somatic receptors. It may be what? Mechanoreceptive sensation, thermoreceptive sensation, or pain sensation. And what is the mechanoreceptive sensation? You can remember? Yes, include the tactile sensation that depends on touch, and we have proprioceptive sensation. So somatic sensation include touch, pressure, vibration, itch and tickle, thermal sensation, warm and cold, pain sensation, proprioceptive sensation, and tactile and proprioceptive, we can join them together as mechanoreceptive sensation. Pain sensation carried by free nerve endings, and pain receptors are usually perceive two types of pain. Usually the pain coming from the skin, as we will know, is characterized by the presence of two types of pain, fast pain and slow pain. Usually, the cutaneous pain or the pain coming from the skin is perceived as fast pain and slow pain, and we will make a good comparison between them at the end. Then we have proprioceptive sensation, which means the conscious perception of the movement and the position of the different parts of the body in relation to each other. Again, the conscious perception of the position and movement of the different parts of the body during rest and during movement. Again, the conscious perception of the position of different parts of the body in relation to each other during rest and movement. This means that while you are now listening to the lecture, you are not in need to look to your legs to identify the position. You feel the position of your legs, of your hands, of your trunk, of your neck without looking. You identify them without looking, and this is known as the proprioceptive sensation. You are not in need to look for them to identify their position. You are identifying their position without looking. This is known as the proprioceptive sensation. Again, what is the proprioceptive sensation? It is the perception of the position of the different parts of the body in relation to each other during rest and movement. And this type of sensation is very important in the production of voluntary movement. You cannot produce a voluntary movement without identification of the position of the limbs, or the position of the trunk, or the position of your hands, or the position of your legs. So this type of sensation is very important for the production of voluntary movement. And as we know previously, all these type of sensation are going to be perceived where? In the primary somatic sensory area, are perceived in the primary somatic sensory area. In this section of the skin, we have different types of receptors. We have different types of receptor, and each type of receptor is specific for adequate stimulus, or for an adequate stimulus or specific stimulus. For example, we have here the free nerve endings. The free nerve endings is specific for what? For detection of pain, for detection of noxious stimuli. They are named as nociceptors. They detect tissue damage. And we have here Meissner's corpuscles that respond to flutter and stroking movement. It is responding to flutter and stroking movement. We have Merkel's discs or Merkel's receptor that sense the steady pressure and texture. They can identify the texture. Also, we have here the Ruffini corpuscle that respond to skin stretch. Bassinian corpuscle respond to vibration. Free nerve endings at the root of hair responds to light touch that change the hair orientation. Light touch that produce movement of the hair. So we have here group of mechanoreceptors like free nerve endings at the root of hair. We have here Bassinian corpuscles. We have here Ruffini corpuscles. We have Merkel's receptors. We have Meissner corpuscles. These are considered as mechanoreceptors, and the free nerve endings are considered as nociceptors. Then we are going to move into an important topic, which means the adaptation of sensory receptors. Adaptation of sensory receptors. What is the meaning of adaptation of a sensory receptor? What is the meaning of adaptation of sensory receptor? Adaptation is defined as the decline in the frequency of the charge with constant stimulation. Decline in the frequency of the charge with constant stimulation. For example, we have here two categories of receptors. One is known as rapidly adapting, and another one is known as slowly adapting receptors. And we have here stimulus on, stimulus off, start, end. Start of stimulation, end of stimulation. Look here for the rapidly adapting receptors. When the stimulus comes, they charge and make a receptor potential, and the afferent neuron generate action potential, and while the stimulus is continuous, the receptor, no response, no receptor potential, no receptor potential. At the same time, no action potential, no action potential. And when the stimulus off, when there is off of the stimulus, office of the stimulus, termination of stimulation, they charge again. they make receptor potential again, and they make action potential again. And during the continuous stimulation of the receptor, when there is continuous application of the stimulus, no receptor potential. So the rapidly adapting receptor are known as receptor that stimulate with the start of stimulation and the end of stimulation. They detect onset of the stimulus and office is the stimulus. They produce rapid decline in the rate of the charge or rapid decline in the frequency of the charge with constant stimulation. They produce rapid decline in the frequency of the charge with constant stimulation. This means that the stimulus is present and they charge only with the start of the stimulation and with the end of stimulation. Example for this, the skin receptors or the touch receptors located in your skin. When you put your clothes, what's happened? They are stimulated with the start of stimulation, and when you remove your clothes with the end of stimulation. And in between, the clothes are present all over your skin or in contact with your skin all over the day, and they are not sending impulses to your brain. So they are stimulated with the onset of the stimulus and with the office of the stimulus. On the other hand, we have another category of receptors which is known as what? The slowly adapting receptors. Stimulus on, the charge, and the receptor potential continues, and the action potential is continuous, while the stimulus is present, they are going to discharge. I'm sorry for that. When the stimulus is present, they are going to generate receptor potential and generating action potential. Whatever the stimulus is present, they are going to respond. Whatever the stimulus is present, they are going to discharge. Like the pain receptors, they are slowly adapting, and sometimes we name it as a non-adapting receptors. What's the meaning of non? They are not going to decline their frequency of the charge with the constant stimulation. Their notification is very important to keep sending impulses to the brain regarding to the stimulus or according to the stimulus, identifying that the stimulus is present. The stimulus is present. This is known as the adaptation of the receptor. The adaptation of the receptor. We classify the receptor into slowly adapting receptors and rapidly adapting receptors. Slowly adapting receptor and rapidly adapting receptor, and you will identify more in detail when we study the visual pathway and visual receptors and also with the olfactory receptors. Receptors vary in how quickly they adapt into rapidly adapting or slowly adapting receptors. Moving to sensory pathways. Sensory pathways. What is the meaning of the sensory pathway? The sensory pathway is the pathway that convey or that carry the sensory information from the stimulus until we reach to the center in the cerebral cortex. The sensory pathway conveys the type and the location of the sensory stimulus. So the information transformed from the receptor will be carried through first order neuron, then through second order neuron, and third order neuron to the cerebral cortex. And cerebral cortex is the site where the sensation is going to be identified. Identified regarding to what? According to their, the cerebral cortex or the center is going to identify their nature, modality, their intensity, and their locality. So the cerebral cortex or the center located in the cerebral cortex, when it receives the sensory information, it is going to identify its site, its location, where is the stimulus applied. Number two, the type of the stimulus applied. Is it pressure? Is it touch? Is it thermal sensation? Is it visual impulses? Is it auditory impulses? Is it taste? It is odor, whatever. This will be identified through the cerebral cortex. And lastly, it's going to identify the intensity of the stimulus. The type, because of the type of the receptor activated. The location, because of the brain has a map of a location of each receptor. So the sensory pathway is going to carry the information coming from the receptor to identify the type of the stimulus and the location of the stimulus. And we mentioned what is the meaning of the type regarding to the specificity. Each type of receptor has a specific type of stimulus to be stimulated, and each type of sensation has a specific pathway known as labeled line principle to reach to a specific area in the cerebral cortex to identify the location. The pathway is usually for the somatic sensation. Is formed from three order neuron. First order neuron conduct impulses from the somatic receptors into the brainstem or the spinal cord. The first order neuron is the sensory neuron that carries the information either to the spinal cord or to the brainstem. This is known as the first order neuron. Second order neuron conduct the impulses from the brainstem or the spinal cord to the thalamus. From the brainstem or the spinal cord to the thalamus. So usually the second order neuron terminates where? In the thalamus. Third order neuron that's going to carry the information from the relay station from the thalamus to the cerebral cortex, to the primary somatic sensory area of the cerebral cortex. The area we name it as previously as the post-central gyrus. According to the Brodmann's classification, it is the area that takes the number 3, 1, and 2. 3, 1, and 2. So the somatic sensory pathways will include first order neuron, second order neuron, and third order neuron. First order neuron from the receptor to the spinal cord or brainstem. Then second order neuron from the spinal cord or brainstem to the thalamus. Third order neuron from the thalamus to the primary somatic sensory area in the cerebral cortex. In this, we have the primary somatic sensory area here. It includes area 3, 1, and 2, and that is the site where all types of somatic sensation is going to be perceived here. All the types of somatic sensation are going to be perceived here. Somatosensory pathways. In the somatosensory pathway, we have here the receptors in the skin, or in the subcutaneous tissue or tendon, joints, or ligaments according to its type of sensation. And we have here the sensory neuron, and we have to identify this sensory neuron. The cell body is located in the dorsal root ganglia. The cell body of the sensory neuron is located in the dorsal root ganglia. So again, what is the meaning of ganglia? We defined ganglia previously as collection of cell bodies outside the central nervous system. So the dorsal root ganglia contain the cell bodies of what? Of the sensory neuron. And these sensory neurons are unipolar neurons, have a peripheral branch and central branch. Unipolar neurons, they are unipolar in structure with peripheral branch connected to the receptors and central branch that go and enter inside the what? Inside the central nervous system. So, no matter the type of the receptors on the receiving end or in the peripheral end, where the receptor potential or the generator potential is generated, first order neuron, somatosensory neuron, are unipolar in structure. First order neuron from the head and neck are carried in cranial nerves. First order neuron from the other parts of the body are carried in spinal nerves. This means that their cell body is located in the dorsal root ganglia outside the central nervous system. Their other end will terminate either in the spinal cord or in the brainstem. Either in the spinal cord or in the brainstem, as in the dorsal column medial meniscus system pathway, or in the pathway specific for the vibration, pressure, and proprioceptive sensation. Their other end terminate nearby in the posterior gray horns of the cord, usually at the level where they enter, and that is specific for certain types of sensation like what? Like the anterolateral system. Another pathway we will study, it ascends directly in the dorsal column. Second order neuron. As I mentioned previously, second order neuron will come from either from the spinal cord or from the brainstem to terminate in the thalamus. So again, the second order neuron will come from the brainstem or from lower levels from the spinal cord and terminates in the thalamus. Terminates in the thalamus. Third order neuron will pass from the thalamus to the primary somatic sensory area. To the primary somatic sensory area. We have here the trigeminal pathway. In this figure, we have the trigeminal pathway. And trigeminal pathway is carrying sensation from face and head. Carrying sensation from face and head. For example, we have here the first order neuron coming from what? Coming from receptors for touch, pressure, vibration, pain, cold and warm, tickle and itch in the face, and even in the nasal cavity, oral cavity, and the teeth. Then the cell bodies are located in the trigeminal ganglia. The cell bodies are located in the trigeminal ganglia. Then the first order neuron enter into the brainstem and synapse here with the sensory nucleus. Then second order neuron ascend on the opposite side in the trigemino-thalamic tract to terminate in the thalamus. So that is the second order neuron. So that is the first order neuron, the second order neuron. And then we have the third order neuron arising from the thalamus to the primary somatic sensory area. That is the trigemino-thalamic pathway or the trigemino-thalamic tract for the sensation coming from face and head. We classify the somatic sensory pathways to the cerebral cortex, into the posterior column medial meniscus pathway, the anterolateral spinothalamic pathway, trigemino-thalamic pathway. Trigemino-thalamic pathway for the sensation coming from face and head. Sensation coming from the body are carried by two pathways. The sensation coming from the body are carried by the posterior column medial meniscus system, anterolateral spinothalamic pathway. The posterior column medial meniscus system. The posterior column medial meniscus system is specific for carrying touch, pressure, vibration, and proprioceptive. Touch, pressure, vibration, and proprioceptive. This means that if we have damage of these fibers or damage of this pathway, there is loss of this sensation. The sensation carried from the receptors by the first order neuron. The first order neuron enters the spinal cord and ascend. It does not synapse with the dorsal horn cells. It ascends in the dorsal column, and it ascends in the dorsal column of the spinal cord into fasciculi. One is called cuneate fasciculus, and the other one is called the gracile fasciculus. We have gracile fasciculus, which is medial, and the cuneate fasciculus, which is lateral. Cuneate fasciculus carry this type of sensation from upper limb, upper trunk, and neck. And we have gracile fasciculus that carries the sensation from the lower trunk and lower limb. Then they ascend to the level of the medulla oblongata, where the first order neuron terminates at the level of the medulla oblongata in gracile nucleus and cuneate nucleus. Then second order neuron arising from the gracile nucleus and the cuneate nucleus cross to the opposite side. Fibers arising from the gracile and cuneate nucleus cross to the opposite side and ascend in medial lemniscus. Ascend in bundle of fibers known as medial lemniscus to reach to the thalamus. In the thalamus, they will end in the ventral posterior nucleus. That is the end of the second order neuron. So the second order neuron started from the gracile and cuneate nuclei in the medulla oblongata. Fibers cross to the opposite side, ascend on the opposite side to terminate in the ventral posterior nucleus of the thalamus, and from the ventral posterior nucleus of the thalamus, the fibers will go to the cerebral cortex through the third order neuron. From the ventral posterior nucleus of the thalamus to the cerebral cortex, that is the third order neuron that arises from the thalamus and terminates in the primary somatic sensory area. Anterolateral system. Anterolateral spinothalamic pathway. It It is known as spinothalamic pathway because the tract started in the spinal cord and terminates in the thalamus. It is concerned with carrying pain, temperature, itch, and tickle. Pain, temperature, itch, and tickle. We have first order neuron arising from the receptor to the spinal cord. Here, the first order neuron arising from the pain receptor, touch receptors of tickling and itch for some of the pressure sensation, which is a pressure, crude pressure plus cold and warm sensation, are carried by the sensory neuron, and sensory neuron will terminate in the dorsal horn nuclei. In the dorsal horn nuclei. So that is the termination of the first order neuron. Second order neuron will arise from the sensory nuclei of the dorsal horn. Then the fibers cross in front of the central canal of the spinal cord to ascend on the opposite side, to ascend in the anterolateral column of the opposite side, to ascend on the anterolateral column of the opposite side until they terminate in the thalamus. So the second order neuron will arise from the sensory nuclei. Then the fibers will cross in front of the central canal of the spinal cord, ascend in the anterolateral column of the spinal cord on the opposite side to reach to the ventral posterior nucleus of the thalamus. That is the end of the second order neuron. Third order neuron started from the ventral posterior nucleus of the thalamus and go to the primary somatic sensory area. Primary somatic sensory area. That is the anterolateral or the spinothalamic pathway. Here we have both pathways. First order neuron of the dorsal column medial meniscus system ascend in the dorsal column to terminate in the gracile and cuneate nuclei of the medulla oblongata. Crossing occur at the level of the medulla oblongata, ascend in the medial meniscus to the ventral posterior nucleus of the thalamus, then to the third order neuron in the primary somatic sensory area. The anterolateral system, carrying the pain, temperature, and crude touch, tickling, and itching, synapse with the sensory nucleus in the dorsal horn, then ascend on the opposite side of the spinal cord. Crossing occur at the level of the spinal cord, ascend in the anterolateral system, to reach to the nucleus of the thalamus, which is the ventral posterior nucleus of the thalamus, then the third order neuron to the primary somatic sensory area. Trigemino-thalamic pathway. Trigemino-thalamic pathway. The trigemino-thalamic pathway is for carrying of somatic sensation from face and head, nasal cavity, oral cavity, and teeth through the trigeminal nerve. That is the trigeminal nerve, which has three branches. One is called ophthalmic, from the sensation of the upper face; maxillary, from sensation of the middle face, upper teeth and the gums, plus the nasal cavity; and we have from the lower part of the face, from lower jaw and from teeth, is coming from the mandibular branch. The first order neuron will terminate either into trigeminal nucleus in the bones or with a spinal nucleus in the medulla oblongata. The first order neuron will terminate here either in the bones or in the medulla oblongata. Then the second order neuron started from the bones or from the medulla oblongata, and the crossing is occurring to the opposite side to ascend in something called the trigemino-thalamic tract, or we name it as the trigeminal lemniscus. To terminate in the thalamus. Then from the thalamus to the area of the face in the primary somatic sensory area. The area of the face in the primary somatic sensory area. That is the trigemino-thalamic pathway. From first order neuron from the receptors, and we have two types of nuclei. One for the pressure, vibration, and proprioceptive sensation. The other one, which is located in the medulla, known as a spinal nucleus, for the pain, thermal sensation, tickling, and itch. Then that is the termination of the first order neuron. Second order neuron will arise and cross to the opposite side and ascend in the trigeminal meniscus till we reach to the thalamus, and from the thalamus the third order neuron will start and terminate in the area that represent the face in the primary somatic sensory area. Another type of sensory pathways is the spinocerebellar pathways. These include the anterior spinocerebellar tract, posterior spinocerebellar tract. From the name, they started in the spinal cord, terminating in the cerebellum, and carrying proprioceptive information, carrying the sensation of the position of different parts of the body in relation to each other. What is the significance? What is the importance of this type of sensation? Because the cerebellum has an important function in the regulation of skilled voluntary movement, regulation of equilibrium, regulation of posture. So usually the cerebellum receives a copy like the cerebral cortex. Cerebral cortex receives proprioceptive sensation. Cerebellum also receives proprioceptive sensation. This type of sensation is not perceived at the level of the cortex, it is perceived at the level of the cerebellum. They are not consciously perceived. You cannot feel it. You feel only the sensation that reach to the cerebral cortex. Pain sensation. How can we define pain? We can define pain as unpleasant, discomfortable sensation which, when severe enough, associated with emotional disturbances or emotional changes. This means that stimulation of the pain receptor is going to give you the sensation of pain, the sensation of noxious stimulus, and this stimulation is not going to stop after the sensation or after the stimulation of the receptor. You have changes occurring in your body due to stimulation of the sensory pathway of the brain that's going to produce changes. Like what? Like somatic changes. What's the meaning of somatic changes? You are going to produce spasm of the nearby muscles to the affected area of the burn or cut. For example, if you have a cut or a burn in your skin, what's going? The muscles surrounding this area will show spasm. For example, if you have a cut or an injury in your ankle or in your knee, you cannot produce complete extension or complete flexion of this part. Why? Because of the spasm of the nearby muscles. This is considered as a somatic change. When you apply a painful stimulus to your skin, what's happened? You have something which is called a withdrawal reflex. You are going to move your hand away from the noxious stimulus, from the painful stimulus. This is a somatic change. Another response, which is what? Exaggerated response. You have something which is called increased neuromuscular excitability. Your response for subsequent stimuli will be increased. This is considered as a somatic change. Also, you can feel non-painful stimulus as painful. You can feel non-painful stimulus as painful. For example, if you have a burn in your skin or injury in your skin by cut or whatever, and you feel the touch as pain. When you touch your burned area of the skin or touch this area of the skin, you can perceive the non-painful stimulus as painful, and this is conditioned as hyperalgesia. What's the meaning of hyperalgesia? Increase the sensitivity of the skin to painful stimuli. There is chemical changes appearing in your skin, making you more sensitive to pain, making you sensitive for pain. Also, the sensory pathway of the pain is usually associated with producing stimulation of certain areas located in the brainstem, located in the thalamus and hypothalamus, to produce emotional changes. Sometimes you have an anxiety with pain. Sometimes you can go into something like crying. You cannot go into a sleep. You have insomnia with the sensation of pain. Why? Because we have pathway, and this pathway or this pain pathway is going to affect certain collaterals or certain group of nuclei in different areas of the central nervous system to produce either emotional changes or even autonomic changes. Sometimes with pain you can feel bradycardia, decrease in heart rate. Sometimes you get nausea and vomiting. There is autonomic changes appearing with pain. Pain itself is a protective in nature. Pain itself is protective in nature. The meaning of pain is protective in nature. It's going to produce or initiate reflexes to avoid the re-exposure to the painful stimulus. to get rid of the noxious stimulus, to identify the subject about the location of the tissue damage. So you are going to look for help or to look for the underlying disease or the underlying etiology. Pain sensation. The mechanism of stimulation of the pain receptor is dependent on what? Is dependent on the release of pain producing substance. The release of pain producing substance. We have here tissue damage by a mechanical stimulus, but also thermal form of energy can produce tissue damage, chemical form of energy can produce tissue damage, and the tissue damage is going to release what? Release chemicals. These chemicals include the pain producing substance, bradykinin, histamine, potassium. These are the substances that produce what? Direct stimulation of the pain receptors. Produce direct stimulation of the pain receptors. And when you stimulate the pain receptors, you are stimulating the pain pathway, which we mentioned before. Can you remember what is the pain pathway? Pain pathway, who is going to tell me? Anterolateral system. The anterolateral system is going to carry the information to your cerebral cortex. At the same time, we have here a reflex which is known as a local axon reflex. This is a sensory neuron, and this sensory neuron have side branch, and this side branch is releasing a neurotransmitter known as substance V. The substance V will stimulate the mast cells to release more histamine, and also it will increase the release and synthesis of prostaglandins. It will produce vasodilatation of the blood vessels to produce what? To produce redness of the area of the skin surrounding the area of energy. So the skin will appear red and inflamed. And you are going to release more histamine. You are going to really stimulate more the pain receptors. And this is why there is hyperalgesia. That is why there is hyperalgesia. Hyperalgesia, you remember, is what? The perception of non-painful stimulus as painful. The perception of non-painful stimulus as painful. Why? Because the stimulation of the afferent neuron will stimulate these side branches, or this, we name it as somatic antidromic nerve. We name it as somatic antidromic nerve to release substance V. Substance V stimulates the mast cells to release more histamine and more vasodilatation of the blood vessels, allowing this area of the skin to be red and inflamed. Histamine will stimulate more the pain receptor. So that's why I told you previously no adaptation of pain receptors. The pain receptors are non-adapting. Types of cutaneous pain. Types of cutaneous pain. The cutaneous pain arising from the tissue damage in the skin is characterized by the presence of two types of pain. The first one is fast pain. Second is slow pain. What is the meaning of fast pain? Fast pain is the pain that appears immediately after the tissue damage. It appears within 0.1 second and lasts only for 1 second. It appears within 0.1 second and usually lasts for only 1 second. This type of pain is carried by A delta fibers. So the afferent neuron here is A delta fiber. Its nature is acute, sharp, or breaking, not felt in deeper tissues of the body. It is usually coming from needle or knife cut. But it is usually a characteristic of cutaneous pain is to have one component, which is fast pain. This fast pain allows you to produce rapid withdrawal of the part of the body away from the noxious stimulus. Allow you to move your hand or this part of the body exposed to the injury away by the withdrawal reflex. Another type of pain, which is the slow pain, which is carried by the C fibers. It is usually appear after 1 second and lasts for long time. It appears usually after 1 second and usually it lasts for long time. It is usually chronic, burning, aching, or throbbing. It can occur in skin and deeper tissues or internal organs. this type of pain carried by the C unmyelinated nerve fiber. It is poorly localized. It is usually felt as burning, aching, or throbbing in nature. It can occur also in deeper structures and in internal organs. Referred Referred pain is a criteria of visceral pain. Visceral pain is usually felt away from its original position. We know that is the site of the heart, that is the location of the heart, and the heart is usually retrosternum with lateral projection to the left. What's going? The ischemic pain of the heart, or the angina pectoris, or the pain of ischemic changes in the heart is usually felt in the left shoulder, left arm, left forearm, and even in the left little finger. That is the pain coming from the heart. It can also project to the root of the neck and even to the back or even to the jaw. So, what is the mechanism of this referred pain? The mechanism of referred pain is convergence projection theory. The meaning of convergence projection theory: we have afferent fibers coming from the viscera and afferent fibers coming from the skin, and afferent fibers coming from the skin. They are converging or meeting at the same segments of the spinal cord. And when this segment of the spinal cord sends the sensory information to the cerebral cortex, the cerebral cortex is usually accustomed to receive sensation from the skin, so the cerebral cortex is going to project the sensation as it coming from the skin. That is the principle of referred pain. That is the mechanism of referred pain, which is known as what? Convergence projection theory. Again, convergence projection theory, or we can name it as dorsal root branching theory. The dorsal root have branches, one coming from the viscera and one coming from the skin, and what's going? They are synapsing, or they are converging on the same segment of the spinal cord. When this segment of the spinal cord sends the information to the cerebral cortex projects the information as it coming from the skin. We have here, for example, the pain coming from the heart, the angina pectoris, the afferent of the heart, the sensory afferent coming from the heart, go to the thoracic 1 to thoracic 4 segments of the spinal cord. So when this segment of the spinal cord sends information to the cerebral cortex is going to what? Give the sensation to the area supplied from thoracic 1 to thoracic 4 or 5 in the skin. The area of the skin supplied by thoracic 1 or thoracic 5. This is known as the convergence projection theory.